Now we'll quickly try to look at some life-saving instructions. So these instructions are basically the ones that you use if you know that a patient is so sick. Okay, that's for immunocompromised patients. So handling immunocompromised patients in a radiology lab. Let's look at it. So it's also all about hygiene, trying to prevent infections. So it requires a lot of care because those individuals, they could easily get infected. Okay, so you are trying to balance what diagnostic accuracy. You are trying to make sure that the imaging you are trying to do is accurate, and you're also trying to make sure that the patient doesn't come down with an infection. So what are the risks? The person has a weak immune system, so they could easily be infected by bacteria, virus, fungals. So hospital environment, of course, that's where disease conditions are being handled. So these microorganisms are all over. So procedural risks too. The person is exposed, all of that. Maybe they want to give them contrast through the veins. A lot of things are there, the risks of contacting infections. So how can you be able to minimize the risk of infection? So strict infection control, all those hand hygienes, using personal protective equipment, disinfect image equipment, minimize patient movement across the hospital areas. You also schedule the workflow. So you can prioritize working on immunocompromised patients when a lot of people haven't actually come to the hospital. So just work on them and you send them back. Then when other regular patients come around, then you also handle them. So reduce waiting time. So once they come, their own is priority. You attend to them. So consider portable imaging. So all those X-rays that you can be able to move around, all those ultrasound that you can be able to move around. Those are the ones that you should prioritize using on this type of patients. You communicate their condition clearly to them because they are always anxious. They have suffered a lot. Then technical adjustment, use immobilization aids gently to reduce motion artifacts without compromising their comfort. So I think basically that's what we got for as regards immunocompromised patients.